Hi, my name is Luis Paladines and we are going to talk about herpes complication. So, what herpes is? Herpes is an infection caused by HSV or herpes simplex virus. This virus affects the external genital and region, mucosal surface, and skin in other parts of the body. Herpes is a long-term condition. However, many people never have symptoms even though they are carrying the virus.
Herpes is incredibly common. Last year there were about 30,000 new cases diagnosed, and most of those were affecting young people, so people between the ages of 20 and 24. Herpes refers to a whole family of viruses, and there are many different strains. Usually it's herpes simplex 1 and herpes simplex 2 that are the strains involved in genital pathology. Herpes is transmitted from person to person in a couple of ways. Firstly, through exchange of bodily fluids, which means through sex, and secondly, by skin-to-skin contact. So even if a cold sore comes into contact with a genital area, it could spread.
Application in medicine. Genital herpes can be easily treated with drugs that inhibit viral replication. Commonly used medications are acyclovir, fanciclovir, and valanciclovir. Treatment can reduce symptoms, the number of outbreaks, and viral replication. Treatment does not cure the virus.
Tends to be more severe. So, what's the treatment? Again, we don't cure herpes. In other words, you can't get rid of the herpes virus, but we can shorten the course of it. So, in other words, if you get painful lesions, what we can do is give you medication so that instead of having it for 10 days, you have it for 3 or 4 days. So, we give what we call Valtrex. Okay, it's a pill, very few side effects and things like that, but we give it to you during the course, and that will shorten the course. The other thing that's important to talk about, especially with HSV2, is how to avoid having future outbreaks. So, one of the big things is to take care of yourself. Low stress, good diet, things like that. The other thing is that you can take Valtrex on a daily basis. You can take 1 pill a day, and that will do 2 things. That will decrease the amount of outbreaks you're having, but it will also decrease the amount of what we call viral shedding. So it will decrease the amount of virus that you can potentially pass to someone.
Pros and cons. So we are going to talk about first pros. Valanciclovir can help to reduce viral sheddings. Viral shedding is a concern because it means that the herpes virus can be spread at times when there are no signs or symptoms. Valanciclovir is the only drug proven to reduce but not eliminate the risk when taken on a daily basis. It may worth noting that some supplements have also been shown to reduce the activity of viral sheddings in clinical studies. Now we are going to talk about cons. There is a long list of possible side effects, including mid adverse reactions such as diarrhea, nausea, and headaches, but also much more serious possible side effects such as kidney damage, hair loss, and depression. Not everyone is affected in the same way. The middle side effects are quite common, but generally most people experience very little to not side effect. Problem applied in Ecuador. In Ecuador, according the 2014 INEX report, 224 people entered health homes with herpetic infection. 50% were men and the rest were women. That year, a total of 1,192,749 people entered these health centers. These medications include Valtrex, Fanny, and Acyclovir. All of these drugs have a similar mode of action and help stop herpes virus from replication inside the body. So, we're finally with the conclusion. In order to determine the type of serotype and the appropriate treatment, it's necessary to visit the specialist and perform blood tests. The checkup is essential to avoid complications, especially during pregnancy. The specialist and the World Health Organization agreed that there is no treatment to eliminate the herpes simplex virus from the body. There are only medications to relieve symptoms.
Welcome to 5 Minute School, and in this video we're going to be talking about the herpes simplex virus, which consists of two viral subtypes. We have type 1 and type 2. The virus is spread by direct lesion to skin contact. Herpes simplex type 1 is usually affecting the face, in particular areas of the nose, mouth, lips, but sometimes the fingers are also affected. The lesions which occur are small vesicles and they can become crusty in appearance. Sometimes the appearance of these lesions can also occur alongside swollen lymph nodes. Herpes simplex type 2 is associated with genital infections, and the vesicles which form usually break down quite quickly and they form painful ulcers. If you are infected with the herpes simplex virus, it's an infection which is present for life, but the virus can remain latent in sensory nerve ganglia and can reoccur or reactivate if triggered. Some of the factors which contribute to the reactivation or reoccurrence of the latent virus can be cold temperature, trauma, immune suppression, and coinciding illness. Usually before the appearance of the lesion, there's a tingling sensation or an itchy sensation before the lesion occurs. Medication used to treat mild forms of the lesion can be topical acyclovir or penciclovir cream. If the infection is more severe, acyclovir is usually prescribed as an oral medication with the dose ranging between 200 to 400 milligrams 5 times a day for 5 days. Some patients who have frequent reoccurrence of the virus can take acyclovir kind of like a prophylactic or like precautionary dose at 400 milligrams once daily. However, this needs to be prescribed and authorized by